Welcome to today's webinar. My name is Randy Marsden, President of MarsdenAdvisors, and we also have joining us today Dr. Brett Rosenblatt and Mike Weiss from ConnectOnCall. Today we'll be going over how to use ConnectOnCall to meet MIPS in 2023. Just a quick legal statement before we get started. This presentation is for informational purposes only. These rules are constantly changing, and as you'll see in today's presentation, some things are still pending, so keep in mind and we'll notify you as we go along what is still pending and what has been finalized. Our outline today, we'll start with a quick review of the latest changes for the 2023 reporting program. We'll go over some high-level category-specific updates and recommendations to keep in mind. But the main point of today's call is to do a deep dive into the improvement activities category. It may have been a while since you've picked or updated or refreshed your activities, so we want to make sure you fully understand that category and see how ConnectOnCall can be used as an improvement activity. Like I mentioned before, this is going to be a quick overview of the 2023 changes before we dive into improvement activities. So I definitely encourage you, if you haven't already, to subscribe to our YouTube channel. You can visit this link, youtube.com/@MarsdenAdvisors, or you can look at Marsden Advisors on YouTube. We'll drop a link in the chat. We just did a presentation last month on the final rule for MIPS in 2023. So we have a much more detailed presentation, even going over specific measure changes that you'll want to check out if you're not aware. You can also check out our blog. We have a final rule blog post there as well. Now, before we dive in, just a high-level overview. We're talking about the Quality Payment Program, or QPP. This is a Medicare program, and there's two ways to participate, either in the Merit-Based Incentive Payment System, or MIPS, or participating in a APM, which could be a MIPS APM or an advanced APM. A majority of today's discussion will be around traditional MIPS. If you are also in a MIPS APM, you'll be reporting pretty similar requirements, and we'll let you know when those distinctions are different as we go along in today's presentation. So I may feel like a broken record, but each year I'm letting you know this program just keeps getting harder. There is now 75 points to avoid the penalty, meaning if you scored exactly that amount, you get 0% adjustment. If you go below that, you can go up to a negative 9% adjustment. And then those who are penalized in that range will pay off the providers in the upper range with a bonus, which can vary depending on how many people score poorly and how many score well, all the way up to 100 points. What you may notice that's missing this year is the exceptional performance threshold, which was a set $500 million for those who performed in a certain bracket. That's been removed, so all positive payment adjustments are now coming from penalized providers.
Now, we all talk about the payment adjustments a lot, but I also want you to be aware of Medicare Care Compare, so this impacts your reputation. So this is a site where patients can look up practices or doctors in their area, compare them, and see performance information from the MIPS program. So if you go in here, for example, look up ophthalmologists in your area, and you select somebody, you'll see important things like the quality score, whether or not they do promoting interoperability, and also right here you can see exactly which improvement activity or activities they chose. So you can pick activities that you think would be relevant to help a patient decide to go to your practice. So it can be used as a marketing feature as well as a MIPS requirement. So just keep that in mind that these are publicly visible as you make these selections.
The MIPS program is made up of 4 categories, and those category weights are the same as last year. So quality and cost are both equal at 30%, followed by promoting interoperability at 25%, and improvement activities at 15%. Another thing you might see is MVPs, or MIPS value pathways, are now available for 2023 reporting. However, none are relevant to ophthalmology, so we still recommend ophthalmologists continue to report using traditional MIPS. We'll now go through each category. So starting with quality, if you're reporting on electronic clinical quality measures or ECQMs, this could be from a QRDA file that you export out of your EHR and upload to QPP, or this could be via a EHR integration with your registry. Some registries require the ECQM versions as well. This update for your EHR must take place by December 31st, 2023. So you actually have till the last day of the year to get updated. We highly recommend getting updated sooner than that to make sure that there's no last minute issues. I expect a lot of people to be updating as late as possible to avoid any new update issues, but definitely get this planned out and scheduled as early as you feel comfortable with doing that. Large practices, so this is greater than 15 clinicians, which by the way, I wouldn't look at the number of clinicians you have today. Go to the QPP site and check your participation status. It's based on the most recent look back period. So if CMS says you're a small practice, you're a small practice. If they don't, then you are a large practice and you must report using those standards. So if you are a large practice, you'll now be scored from 1 to 10 points per measure, which used to be scored at least 3 points. So now it's a full 1 to 10 point range, or 0 points if you don't meet case minimums, which is a 20 case per measure, or you do not meet data completeness. Small practices will continue to get the 3 to 10 point range per measure, or 3 points if case minimums or data completeness are not met. And there are several quality measure changes, but one to highlight for ophthalmology is the diabetes eye exam measure 117. That's a dilated eye exam measure, has been removed from claims reporting. So claims continues to get harder. We actually do not support claims reporting anymore for our clients. So if you are using claims, you should look at other options like manual reporting through a registry, or finally getting up and running on an EHR. Promoting interoperability changes. So like I touched on in quality, we have the new EHR version requirements. So this might be a little confusing, but by the first day of your performance period, you need to be using a version of your EHR that includes the Cures update functionality. So that means you need to be able to use all of the features that are required under the Cures Act by the time you start your reporting period for promoting interoperability. Keep in mind, you only need to do a 90-day minimum. So, as long as you get this started before that 90-day period that you pick, and you get updated, even if it's not the certified version, as long as it has the functionality, you're good to go, and you'll want to check this with your EHR vendor. By the last day of your performance period, which could be all the way up till the end of the year, if that's the end of your performance period that you choose, you need to be on that actual version that's using 2015 Cures Update. You can check your version number and compare it to chpl.healthit.gov to see if that version is the current one. A lot of cloud-based EHRs are already getting everybody updated to that version, so you may already be on it and not even know, but definitely check with your vendor to make sure you have that either already updated or you're on the schedule to get updated this year. Also, the optional measure query of prescription drug monitoring program, or PDMP, is now required, and there are 3 possible exclusions. And the overall points across this entire category have been shifted to allow for these additional 10 points to fit in. Also, date restrictions have been added to the public health and clinical data registry objective. So if you are in pre-production and validation phase for one of the options, you can only be in that phase for up to 1 year. So make sure you're keeping up to date with the public health agency that you're reporting to, and that you're responding to them and getting that set up on your end as soon as possible. And also, there's a new option for meeting the health information exchange objective. Most practices fulfill this using direct messaging of CCDA files between practices. You can also participate in the HIE bidirectional exchange, which was added a few years back. And now you can enable exchange under TEFCA. This is a new framework that is still being rolled out. So if you're not familiar with it yet, you probably don't have that available, but it is a new option that you can look forward to as that is implemented. Cost change highlights, very simple. Really, the only big change here is that there is a new improvement score bonus. So if you improve on a measure from 1 year to the next, or multiple measures, you'll earn up to 1% improvement of the overall category score. And bringing up our YouTube channel again, we did do a deep dive on the cataract cost measure, which can be a little confusing of a measure for ophthalmology. Definitely encourage you to check that out, that we published last month. So now we'll come to the meat of the presentation, the improvement activities category. It's a pretty simple category, so I know a lot of you may not really think too much about it. Usually quality and promoting interoperability are the things you're most concerned about, but definitely take a look here as there's a lot of new measures that are available and some measures that you may have been reporting on no longer exist. So first of all, we have 4 new activities. They're all listed here. The full descriptions of these are currently in the final rule, but they will be available on the QPP site shortly. For example, you can do the COVID-19 vaccine achievement for practice staff. If you also manage an ASC and you're doing COVID-19 vaccine reporting for your personnel on that side, this actually might be a great activity to do because you're already going through that entire process. 6 removed activities. So note, if you were using any of these QCDR measures, which if, for example, if you're using the IRIS registry, you may have been using these activities to meet this category, they've actually all been consolidated down into a single activity. So you may need to find some alternative activities to pick. And there's 5 changed activities. For example, the QCDR measure or activity that did remain has been consolidated from all those other items. So if you're using any of the removed activities or changed activities listed here, definitely take a look at the specifications after today's call and determine if you can continue to use any of the changed activities or if you need to set up new ones, especially if the one you were doing was removed. There are 2 types of activities, medium weight and high weight. So medium weight activities are 10 points standard and high weighted activities are 20 points standard. You need to report on enough activities to earn 40 points. So typically you would need like 4 medium weight, 2 high weight, any combination of the 2 to get to 40. Activity points are doubled based on your special status. So small practice, rural, health professional, shortage area, or non-patient facing. You can check all of these statuses on the QPP eligibility site. There's some alternative ways to earn points in this category as well. So if you attest to participating in a patient-centered medical home, PCMH, you can get the full 40 points. If you're participating in a MIPS APM, you can get at least 20 points to start. So you still need another 20 points in order to get the entire category score. Now, the improvement activity requirements. So each activity needs to be implemented for a continuous 90-day period. If you're reporting as a group, at least 50% of your clinicians must implement the activity. You can do the same activities each year unless the activity specifies otherwise. So definitely make sure you're reading the specification for your activity, as some of them are not allowed to be done year after year. Each activity has specific data validation requirements. You don't need to submit the proof at the time of submission. This is something that I find whenever we start working with a practice, they're not even familiar with where to find this. And I don't blame anyone because CMS does not make this easy. If you go to the QPP site, you can check like the measure specification, like the description very easily. But in order to get the data validation requirements, you have to download a zip file and then extract it and then go to an Excel file in the zip file. And then it explains exactly what an auditor will be looking for if they're auditing you. And this is very timely because at the time of this recording, CMS has announced that they are returning to doing data validation audits. And we have already received some audits for some of our customers. So getting this information ready as soon as possible will just make it easier for you in the future when you have to provide that proof if that comes up. So we recommend gathering that proof as you implement the activity in case you're audited in future years, and that could be up to 6 years from now. So if you pick an activity and you do it and you say you did it this year, 6 years from now, are you going to remember exactly what you did, or are you going to be able to find all that proof? So definitely capture it all now, save it with the rest of all the proof that you save. We recommend creating like a folder or what we call an e-binder, which is what we prepare for our clients, which just contains everything you would ever need in the event of an audit, all wrapped up and securely filed away. Resources, so you can check all the activities at qpp.cms.gov in the measure library. Choose the improvement activities tab. Make sure you're set to 2023. However, I will note at the time of this presentation, the measure library has not been updated yet for 2023. Data validation criteria is in another section of the same site under the resource library. You'll want to filter on improvement activities or search for data validation criteria, and you'll be able to find that. And also at the time of this presentation, that hasn't been updated yet for this year. Now, like I mentioned at the start of this, ConnectOnCall is a great program that a lot of our customers are using, and their technology actually helps support a very common improvement activity that I think a majority of you on the call probably already do, which is the providing 24/7 access to MIPS eligible clinicians or group who have real-time access to patient's medical record. So this is a high priority activity. So if you're in a large practice, you would just need to find one other high priority activity that you can do. Or if you're in a small practice, rural health professional shortage area, or non-patient facing, this would completely satisfy the category. And this may already be something that you're doing. Keep in mind the description and the data validation criteria we'll be covering on today's call are based on last year, 2022's requirements, because the 2023 information is not yet available. But once it is available, I would check it just to confirm it hasn't changed. We don't really expect any changes because we didn't see anything highlighted or notated in the final rule. The description here is to provide 24/7 access to MIPS eligible clinicians, groups, or care team for advice about urgent care. For example, this could include the MIPS eligible clinician and care team access to medical record, cross coverage with access to medical record, or protocol driven nurse line with access to medical record. It could include one or more of the following. So you could either have expanded access in the evenings and weekends with access to patient medical record. So for example, you could coordinate with small practices to provide alternate hour office visits and urgent care. So we see this a lot in smaller areas or with smaller practices that all work together and have their own on-call schedule. So you can definitely do that as long as there's access to the patient medical record. Use of alternative visits to increase access to the care team by MIPS eligible clinicians and groups, such as e-visits, phone visits, group visits, home visits, and alternative locations, such as senior centers and assisted living centers. So this is usually like one of the most common ones that we see and that we usually get proof of, and that's a doctor going on a call with a patient, over the phone. We're now starting to see some telehealth pop up, or maybe the doctor goes to visit them in the senior center or assisted living center. So, anything that's not that standard approach of care that you have where a patient's coming into your office during normal office hours. Or it could also be provision of same day or next day access to a MIPS eligible clinician group or care team member when needed for urgent care or transition management. So if you get a call, it's an emergency, you say come in, first thing in the morning, those scenarios count as well. I'm now going to hand it off to Dr. Rosenblatt from ConnectOnCall, who's going to show you a brief demo of their product, which not only helps meet this requirement, but it does a lot of other great things that a typical after-hours phone system is not going to be able to do. So take it away, Dr. Rosenblatt.
Thanks, Randy. I appreciate the introduction, and I appreciate the time you're giving me to talk about ConnectOnCall. I have a brief slide deck that will demonstrate some of the high-level features, as well as how ConnectOnCall perfectly supports that MIPS 24/7 access to clinicians for advice in urgent care. I also hope to show that we do a lot more to make after-hours care more convenient and efficient for everyone. So along with two of my partners, Vince DeRamo and David Ree, we created ConnectOnCall about 10 years ago, primarily to address the problems that our practice, a relatively busy retina practice, was dealing with. And many of these issues will be familiar to you or anybody that is involved with a practice that covers calls. So one of the things our doctors and patients, as well as our staff, were frustrated with the poor communication, lack of documentation. For instance, a patient would show up in the morning being told to be there by the on-call doctor, but the staff wouldn't know anything about it. It would create a lot of inefficiencies for our office. And as many of us know, with traditional answering services, often you would get the wrong callback information. You'd often miss calls. Sometimes you couldn't call a patient back with your phone number blocked, so you had to display your personal phone number to the patient. In addition, we had just started with MDI. Now it's IntelliChart Pro with Nextech. But at that point, we were frustrated that the information that was entered in the chart during the day wasn't available to us when we were on call speaking to a patient. And then that information wasn't getting back into the chart after we spoke to them. So we went about creating ConnectOnCall to solve these problems and many more. And over the years, we've grown. We have about 450, probably closer to 500 practices now that take call with us every night. So we deal with a lot of messages, a lot of patients, and we support practices of all different sizes, specialties, and ways of taking call. So let me show you how it works on a high level. This is an overview, but I think it'll give you a sense of what's happening if you were to use ConnectOnCall. So just like with traditional answering services, you'll forward your phones after hours or on the weekend, or if you're on a lunch break practice meeting, or even for overflow calls. You'll have a completely custom greeting that plays for the caller, and will make the greeting work for your practice. You can even change the greeting whenever you want. And then we'll ask the caller a series of questions to make sure we direct them properly. And this is just a typical layout, but we will ask if you're calling from a doctor's office or hospital, or if you're calling as a patient or for a patient. And then once that decision is made, the caller will indicate whether it's a non-urgent or an urgent call. We've made the system very convenient, so callers get through this call tree very quickly. Now, an urgent call will notify the on-call doctor, and we have a very reliable way to make sure that the right doctor gets notified in the way they want to be notified. And I'll show you in a slide or two, how the notification methods work. And if someone leaves a non-urgent message, we'll never notify the on-call doctor, but we will include the non-urgent as well as the urgent messages into a detailed daily documentation report, which I'll also show you in a few slides. The messages and their documentation will go back into your EHR chart automatically. And as you'll see in a moment, the integration with EHR also benefits the doctor because when they're handling the call, they'll see the patient information, and the patients love it that the doctor's calling them back and already knows something about their history. So let me show you a little bit of a demonstration of what the doctor or provider on call will experience. In this case, you're seeing a screenshot of an iPhone, although we have native apps for both iPhones as well as Android devices. So a new message came in, and you'll see on my phone, you get a push notification. Just by tapping the notification, you'll get into the ConnectOnCall app, into the message that you need to handle. And we designed it to be very easy to quickly go through all these steps, but you can go in any order you want. I know some of my partners just like to call the patient back, but what we recommend is first view the patient information, and this will be up-to-date information from your chart. You'll see some demographics, medication, problem lists, if there's been any recent injections or surgeries, allergies, referral doctor information, and you just quickly familiarize yourself with the patient. And then once you've done that, you can tap a button to call the patient back. And we have different ways of calling the patient back depending if you're on Wi-Fi or cellular, but in all cases, the patient will see your office number as the caller ID. We never display your personal mobile number to whoever you're calling back. So after you've spoken to the patient, given your recommendations, you can now quickly document the call. We make it easy to document as well. My favorite way of documenting is using what we call the quick pick. It's basically a drop-down list of the common things we deal with on call. So if it's a injection symptom that they called about, or if someone's having flashes or floaters, your practice may have a quick pick that automatically documents a full paragraph based on that concern. And you can also free type or use speech to text, as you're seeing here, to document something more specific or to add more detail. So you're done handling the call. There's other bells and whistles. You can flag the message if you want easy access to it to call the patient back later on the weekend. You can reassign the message to other doctors, and there's other things that you can do that just will add some value when you're on call. So I want to show you briefly a screenshot of my notification methods. So this is completely customizable for any doctor or any provider that takes call. And you can see in my example, I have push notification first. So this means that if I get a new message and it's urgent, I'll get a push notification. If I review the message or call the patient back, I won't get any further notifications. But if I don't, then we'll go down this list and notify you one at a time until the message has been handled. So you can see I have text message, phone calls, home number, email. The list can go on if you want. And we even have ways of having backup providers or doctors on the system as well. Moving on to the documentation report. This report is viewable by any of your staff or managers. They can view it any time from any computer, but they'll also get an email reminder if there's been call activity over the weekend or after hours. So in our practice, our staff checks this each morning. They review the messages and take care of any follow-up. You'll see both the urgent as well as the non-urgent messages. They can either listen to the message or read the transcription, and then they can mark that they reviewed and handled that particular call. And we'll have a signature date timestamp for each of the staff or managers that handles it. And there's other things they can do under the action button. If they want to add notes that go into the EHR, they can view the patient information and other things that make it more convenient to work off this documentation. In our practice, uses this documentation report actively for both after hours and during the day for nursing calls and other overflow calls. So that's the documentation report. Let me show you the on-call calendar. Basically, it's real easy to make a call schedule. In our practice, we change call every week. So all we do is enter a name on the date of the call change. We can make a call schedule a year in advance, or we can make a call swap anytime from anywhere. We know that a lot of practices have different ways of taking calls, and we've built in a lot of customization and features, and I think that we can accommodate just about any call logic that a practice uses. I think that's important. And here you can see that it's very easy to pick a name from the drop-down. Once you pick that person, they're on call. So that was a high-level kind of quick overview of our system. I think there are a lot of benefits to using ConnectOnCall. It does improve the patient care and experience. You don't miss any calls. Office staff always knows what's happening, and the follow-up is much more reliable. Everything is documented. And over a traditional answering service, I know that you'll save a lot of time. Patient also doesn't have to wait on hold, doesn't have to repeat their story. Documentation literally takes seconds and everything goes back into the EHR automatically. Everything is HIPAA compliant. So yeah, I think we've built a system that works very well and solves many, many problems. I think what we're most proud of is the extremely high satisfaction rates with our service. We've taken our time and really built a robust, reliable, and very convenient service that really helps doctors, staff, and patients. We know that our solution solves many of the problems that we used to deal with and many of you are still dealing with. I also want to mention some other solutions that ConnectOnCall offers. Our practice and many others use the weekday assist, which reduces call volume, basically helps with overflow or nursing calls or any specific calls that would be better to use our automated service. The integration with the EHR makes our staff much more efficient in dealing with calls during the day. We also have a telehealth solution that's either freestanding or integrated with the after-hours solution. So if you needed to convert an after-hours call to a telehealth visit, you can do that with a key press on the app. And then patient texting is great. We all know that many patients, and certainly many of us, prefer to text over phone calls. Problem is being HIPAA compliant. So with ConnectOnCall's patient texting, you have the convenience as well as the HIPAA compliance. So I just want to thank everybody for their time and the opportunity to speak about ConnectOnCall. We would love the opportunity to review some of the other features, and in particular how we can customize our service to meet the needs of your particular practice. You can see our contact information below. The best way is to email us at sales@connectoncall.com. And once again, thank you for your time.
Thanks, Dr. Rosenblatt. I definitely encourage all of you, if you haven't seen this in action or you haven't spoken with Connect on Call yet, definitely do. A lot of our customers use this when we request the proof of the improvement activity to put it in the e-binder and we get the Connect on Call report. Our client success managers are very happy because we know it has everything we need and it's coming from a reliable source and it can easily be exported out of that system. Also, it's created by doctors that use the product daily in their own practice. So definitely is designed with all of you in mind. Now, on to the really interesting stuff. How do you prove that you're meeting this improvement activity? So again, we're talking about that 24/7 access high priority measure. So the data validation criteria is evidence of demonstrated patient care provided outside normal business hours through expanded practice hours and by eligible clinicians with real-time access to patient electronic health record, or that patients received needed urgent care in a timely way. So I'm going to pause there. So one thing, and I think this is often not really fully understood, is that the expanded practice hours need to be in conjunction with access to the medical record. So if you're still on paper charts, it's very difficult to try to get direct access to the medical record when you're not in the office. And really the only way to meet this is to have access to that. Not saying you need an EHR or you need something like ConnectOnCall to be able to do this, but it definitely limits your options for meeting this measure. Expanded business hours are defined as hours that are outside of a practice's standard business hours of operation. This is another point to keep in mind. So make sure you have somewhere in your office policy or office manual or anything standard or normal in your office that defines what your business hours are and what on-call hours are. And that you have an on-call schedule similar to what Rosenblatt showed. It doesn't have to be very fancy, but that calendar built into the system is also a great way to prove when you are off hours and who's responsible. In terms of the documentation, it needs to include either a patient record from the EHR. So this needs to be a patient record with a date and time stamp indicating that services were performed outside the practice's normal business hours. And it does not need to be a certified EHR. It can be pretty much any kind of secure way of documenting this. So if you were to put those notes into ConnectOnCall, and then those end up making their way over to the EHR, then you can definitely pick up the reporting from either side there. The other option is a patient encounter, medical record, or claim that indicates that the patient was seen or services provided outside the normal business hours for that eligible clinician, including the use of telehealth visits or services provided in an alternate location like a senior center, assisted living center, and so on. So this could be just a record that is done, separately, or in the case of ConnectOnCall, you're reviewing the record, you're putting those notes in that shows up in the documentation report. So that would count as well. And then the last option is same or next day patient encounter, medical record, or claim. So this is if you're, let's say you end up seeing the patient during normal business hours the following day, you'll want to make sure that somewhere in that record you're indicating that this was the result of an after hours call for an urgent reason, because that encounter for the next day will obviously, or maybe during your standard business hours, which wouldn't qualify. Regardless of which option you use here, regardless of whether or not you use ConnectOnCall, like I said before, the biggest problem we see with this activity is that there's no proof behind it. So, make sure you have a clear defined policy of how you handle after hours calls if you're using this activity, and then figure out, if you were to be audited today, how are you going to prove it? So in the past, we've collected like a patient example just to make sure our clients know how to go find one of these. But if you can, and if you have the ability to, we definitely recommend that on top of that, you just pull a report for the reporting period of all of the calls that took place. That way you have a complete record ready to go. You can send it right over to the auditors. They'll probably pick a few out of that list and then ask you to go get the full record for those. So if you have that documentation report in ConnectOnCall, you can easily export that out. Or if you have any other methods, like you are putting these on your calendar, you could run by appointment type or encounter type or some way to filter these out easily. That's what you'll want to do here. At the end of the day, and something I like to clear up, the objective for that, the reason why CMS created this activity was to reduce the number of emergency room visits at hospitals. So if your policy and your activity and what you're doing is following that, you're trying to reduce the patient from having to go to a hospital, can this issue be resolved by a phone call, by a text message, by seeing the patient wherever they are, then you should be fine with that activity, and you don't really have to worry about too much of all the different options that they're giving you in the activity description. Now, This whole program, as I said, is getting very hard, and keeping up with each of these items can be rather difficult. So I definitely wanted to quickly present you with what we do. We have a MIPS success plan. We help over 1,600 doctors nationwide, approaching 300 practices now with the MIPS program. We completely outsource it. We take on the reporting for you. You can think of us as like a tax accountant, but for MIPS. We pair you with a dedicated client success manager. We meet with your administrators, and we provide staff training materials specific to the categories and the measures you're reporting on. So you don't have to dig through hundreds of pages of EHR documentation. We help make sure that everything's set up properly. We create that training material for you. We work with your EHR and registry. So if you're not set up or your integration is having problems, we can take all of that over for you. You don't need to be on those back and forth emails and dealing with that blame game. I think the thing that our customers enjoy most is that we do auditing. So we look at the measures that we set up with you, and we identify patients who are not meeting the measure, and then we go find out why. We have staff who have worked in clinics. We have staff who have worked at EHR companies. Sometimes we have access to the back end database. So we have a lot of people on hand that can help identify the root of the cause, which is usually like a training issue or a technical issue, or sometimes it's not even the registry's fault. Sometimes the EHR isn't even sending that data to them. So we're able to easily pinpoint that. And because we work with so many practices across the country, mostly in ophthalmology, when we find an issue at one practice, at a certain EHR, typically it's the same across the board. So we sometimes are able to even proactively identify problems before you even are made aware of that. We don't really care how you submit. We are not like a separate registry, so we can either submit directly out of your EHR, or we can use a registry like Iris, or we have other partner registries if you need an alternative. I'll give you some secret sauce, secret tips, what we're doing this year to prepare our clients for 2023. So as always, this is our mission is always implementing the newest, most relevant measures, most specialty and subspecialty specific measures available. If you're on the IRIS registry, there are 48 measures specific to ophthalmology, and more get benchmarked every year. We are purposely implementing measures that have not been benchmarked with our clients in order to get them benchmarked. So if you see a lot more available this year, that's due to people like us proactively going and setting those measures up. So we encourage you to take a look at that, as there's a lot of measures that are being removed or being capped or topped out. And the newer measures are usually easier to report on because they're looking for very common data points like visual acuity after a procedure, or any kind of post-op results for procedures. So it's a lot less checking the box to say you did something. Assisting clients on paper or decertified EHR to transition to certified EHR. So something that's different that hasn't really happened before is on December 31st of 2022, if EHRs were not certified to the 2015 Cures update, they are no longer certified. So if you check that site and you check your version and you're not certified, you got to figure out an option. First, obviously check with your EHR. We do know that some EHRs are not even going through with the certification update. So you're going to have to find a solution, especially if you're required to participate in promoting interoperability. You can still get by with reporting MIPS without a certified EHR, but you're going to lose out on a lot of points. Obviously, the most of you are going to be able to get an upgrade if you haven't already. Also, if you're on paper, I highly recommend this is the time to get up and running on EHR. This is the year. I've said in the past couple of years you can kind of hold out and get by with this program, but it's a snowball effect. You have this program, which is very difficult without EHR, and then you're going to combine that with the Cures Act requirements, which are even more burdensome. It's really the time to get started and review these systems. These EHRs are much more mature now, and we've had a lot of success getting practices up and running on the latest and greatest EHRs. Also, if you are switching between systems, we provide migration services, so we can migrate your clinical data, in some cases directly from the same field from one system to another, to make that very easy to continue on with the new system. Overall, we're working with clients to make sure that they get that update. Also enabling the prescription drug monitoring program, and also enabling public health reporting when required. We are also developing a way to analyze cost reports to identify outliers and billing issues. So cost category has always been a quandary of like, how are you going to do? We have been working on some analytics reports based on the data that CMS provides, also using practice management billing data to help identify that. And we'll be releasing that to our clients this summer when the latest cost measures are released. And just like I mentioned earlier, and I stressed heavily, we help you gather all that proof, making sure you're audit ready on the day that you submit. So just to wrap up before we go into Q&A, if you'd like to learn more about us, you can email getstarted@MarsdenAdvisors.com if you have any questions about today's webinar. Also, if you have not started with us already, we have discounts on our MIPS Success Plan that expire this month. We are very eager to get practices up and running now. The longer you wait, the more work it is for us to get everything up to date. So if we can start now, it's actually cheaper to start now than to start later in the year. So definitely reach out to us and at least get that conversation started with us so you can take advantage of that offer. Also, we have a lot of upcoming content available, including how to retire your old EHR or PM system on Thursday, January 26th at 12 p.m. Eastern Standard Time. If you have already switched EHRs and you have an old server up and running, or you are making a switch, or you just don't know what to do with all this old information, we'll go over what the requirements are, some strategies, and we'll also plug our new app, Kaival. It's our web-based app. For only a couple $100 a month, you can have all your data stored securely with a connection to your current system, and you can retire those old servers and save a ton of money. If you're interested in ConnectOnCall, that's that HIPAA-compliant system to route urgent calls to the ConnectOnCall provider with those features of after-hours calls, daytime calls, patient texting, and telehealth that Dr. Rosenblatt went over earlier. You can schedule a demo with them. We will drop the link in the chat. You can also email sales@connectoncall.com.